Hello, and welcome to an overview of American Indian Alaska Native Substance Abuse Prevention Skills Training. My name is BC Echohawk, and I'm a Communications Coordinator with the Native Connections TTA Center. On behalf of the Native Connections team and Contracting Officer Representatives Maureen Madison and Jan Dunbar Cooper, I'd like to thank you all for joining us today. In a few moments, we'll start our presentation, but first I'd like to review a few housekeeping items. Today's webinar is being recorded and a replay will be available in the near future. Because we are recording, all phone lines will be muted to minimize outside noise. But please don't hesitate to use the chat box for questions throughout the session. I'm going to open in a good way, and our fellow grantee technical assistant is going to facilitate that for us, Leon Leadercharge. If he's in the room, he is, so.
Hi, good afternoon. Can you hear me?
Yes, we can, Leon.
Oh, thank you. That's a beautiful picture, by the way. In our culture, in our nation's beliefs, we open the day with a prayer to the morning star. We call him Poik Chakpi. And then we ask for help for the day as we walk in Creator's will. And at the end of the day, there's another part of the day that looks red. It's the evening, and we pray to the evening star, and we give thanks for the help we receive for that day. So, and that way, I'd like to say thank you guys for joining our training today and the work we're doing. It's pretty heavy, so I want to ask the Creator to bless us. Creator, to kashira wakantaka na ahituayo to kashira mitakiapi na homini. You chosen na wo ke wangaki to kashira. Our relatives who meet here in this circle, we ask for good health, and that you watch over us. E tu kashira na wakainja na Lakota na oyate kina unkia pono ushla pero na oyate kina lila kakija na otehi kelo tu kashira unkia pono ushla pero. Creator, the kids, and there's a lot of children and youth and relatives who are having a lot of hardships and difficulties, and we want to ask that you help them and give them good health. And all my relations, Amandaki, I say, Waka tanka toka heya che wakielo yo. Waka tanka toka heya che wakielo yo hey mitaku ye yo wanita cha toka heya che wakielo yo hey. Oh, thank you.
Miigwech. Thank you, Leon.
Hey, thank you. Little Wapala Tonka Chiche, Leon. A beautiful song. I wanted to join you with that. What a good way to get us started here. So how Madakapi Machante Washte Chichaplo. Thank you to everyone who joined us today, and hope that you will get something good from our presentation today. And again, thank you for joining us. Dave Braveheart Imachapi, I'm Gal Lakota from the Pine Ridge Indian Reservation, and I've come to you as a grantee technical assistant, and it's good to have you. And I'll turn it over to you, Connie.
Miigwech, Dave, Bojo, and hello, everybody. Connie O'Meara and Dishnakas, Albuquerque, New Mexico, and Donjaba, Nishnabé, Potawatomi, Citizen Potawatomi, and Dow. I'm like Dave, I'm very excited to have you all here. We have been doing the training. Dave is an old hat at this. He's been doing it for many years. We've always thought that it would be a great benefit to our Native Connections communities. I'm also a GTA, so I have some grantees and I hope you're on here, but we're really looking forward to working with you today and giving you a little slice of this training, and hope that maybe you'll join us for one of our 4-day trainings. Thank you. All right, so we're gonna do a little icebreaker. And originally I told Dave, let's just ask them if they're wearing pants, but then I realized that some of you actually go to work. And so I think some of you are. So what we're going to do is we're going to get to know you by your name. You can put this in the chat box, the community that you're from. And then all of us have a superpower. All of us have something that helps us do this work. Even when we're tired or at our lowest, even when it's been a really rough week, there's a superpower that we all have. I'm going to share mine. I'm going to ask Dave to share his. And then I'd like you guys to just put those in the chat box. What is your superpower? What makes you kapow out there and make a difference? So for me, I really feel like my superpower is learning to do self-care better and better every day. I am really working on that. After being in the field of social work for 30 years, it was time to learn how to take better care of myself. So self-care, like walks and my morning routine, my morning blessing are what helped me. So I'm passing it on to Dave.
Hey, that's awesome, Connie. Yeah, your self-care is contagious. I appreciate it. So my superpower was usually going to be humor, but I'm going to pass up on that one because today, believe it or not, it is being a good relative, and being a good relative is working with tribal communities from across the lower 48 and Alaskan Native villages. We are all in this together, and we are all related. So, and wherever I go, I want to be a good relative to you as if you're family. So there you go.
Thank you, Dave. Thank you. I see that Joy introduced herself. Joy, let us know where you're from when you get a minute. And Linda from the Helena Indian Alliance, and Dempsey Davis from Tuba City. Glad you're here. And then don't forget your superpower. BC is reminding you, we have Uniba Banos from the Cocopa Indian tribe, and her superpower is learning to leave work at work, not taking it home. Woohoo, that's a good self-care one. That's awesome. All right, and Allison, she's an early bird. She's gonna get there early from Anchorage, Alaska.
Everybody gets the win.
And we have our Yupik name Yari, originally from St. Lawrence Island, and gives the clan, I don't want to butcher it, so I won't read it. You guys can read it, but she's compassionate and passionate about the work with our people. And I'm so glad to hear that. And that's what it takes, really. And Dawn Masqua, Prairie Band Potawatomi, is continuing to learn, always willing to learn. So that's a really important one. We always have stuff to learn. Carolyn Ramos, she's from the Young Adult Services Fairbanks Native Association, and spreading positivity. Awesome, thank you. We need that. We always need that. It's been a rough year and it's going into another rough year, so we need that. Sheila from Sault Ste. Marie, her superpower is morning riser. Me too, I like to get up early. I like to rise early and get it done. Then I fall asleep at 9 o'clock. Just kidding. Okay, all right. Julie and kindness. She's a Saginaw Chippewa. She's one of our GTAs in kindness. That's a very important one, Julie. Thank you. We have Vernon introducing himself. Jenna Larson from Anchorage, Alaska Youth Services, and her superpower is positivity and being uplifting to those around me, an encourager. Awesome, thank you. We might call on you once in a while, Jenna, we might need that. Edith Carmona, Southern Indian Health Council from Alpine, California, superpower is optimism. We definitely have a lot of optimism right now. All right, thank you. And then Tara Duskowski, I'm not sure if I got that right, Director of Culture and Education for Alaska Native Heritage Center. Music, awesome. We might call on you because we're doing a music activity today. Might just ask you, Tara, what some good songs are. So Henrik Brandt, Nome, Alaska, superpower is helping his family out. Awesome, so important right now, especially being safe with our family and helping them out. Pueblo Zia, superpower is high energy and creativity. And then there's a correction on the youth service coordinator, not director. Thank you, thank you. That's from Jenna. Linda, I'm still developing, acknowledging my superpowers. One superpower is recognizing my grandfathers and grandmothers who are beside me, especially during this difficult moments. Yes, that is so important. I also think of that at times, especially on the hard times. Janelle Batiste, Native Connection Project Director in Livingston, Texas, Alabama Coshada Tribe. Superpower is compassion. Jess is movement. Yes, we have to move. We're in our chairs a lot. We got to make sure and move and have some fun. Do no harm, Sandy from Juneau. Do no harm. Eric, observe and listen actively to understand. So important. And then Samantha, superpower would be care about all the people around me, which keeps me on my job on the small island, but also remembering to keep it at work and not take it home. All these are excellent. You guys are superheroes. We're glad you're here. Keep up the good work.
Welcome to our webinar today on the it's officially called the American Indian Alaskan Native Substance Abuse Prevention Skills Training. It is a 4 to 5 day curriculum that we use for training. That's a typical face-to-face training, but we have developed a virtual training we'll talk about a little bit later. But this is or what we consider a SAPST approved curriculum that's been around since 1999. And we know that substance abuse is also a risk factor that contributes to suicide ideation, attempts, and completion, unfortunately. So one of the important reasons why we wanted to bring this webinar to you, and there have been many other tribes who have had this training, and it's really awesome, particularly in terms of using the 5-step process in planning. It's called the SPIF, Strategic Prevention Framework. And so this 5-day training, we have it broken down into 4 sessions, but it's actually a 5-day. There is an online introduction training that's a 5-hour training that takes place, and then the face-to-face is day 1, where we focus on setting the foundation from theory to practice, and this is really more about principle prevention. Some of the folks in this room have been in prevention for a while. Some might be newcomers. This is the type of training that would be very beneficial to you. We also know that this training is can help folks with certification, recertification, and we'll talk more about that a little bit later. And of course, the 2nd, 3rd, and 4th day, we really get into the SPIF, the Strategic Prevention Framework. It's a 5-day process where we talk about assessment, capacity, building capacity, cultural competence, weaving in culture in all of our activities that we're doing in our community, and planning, and then implementation, and then we get into finally evaluating, and the importance of evaluating every step along the way to when an activity or event is completed, and we want to go back and visit the evaluation points on that. We also talk about sustainability, and you probably heard this one before. When do we start sustainability planning? And the answer is day 1. So there you have it. We're going to go through this this process with you today, and it's really awesome to have you here. So let's get started. So this is a curriculum that's been developed by SAPST with their Center for Substance Abuse Prevention Center, and back in 1991 in collaboration with the CAP, the Center for Application Prevention Technologies, and has been around, used by states who got a grant in prevention. Some of you might be familiar with the SPIF TIG or SPIF SIG. It's a state's incentive grant or tribal incentive grants. The PFS, Partnership for Success, and other prevention grants from SAPST. And they have developed this curriculum to talk about how to do your do planning around prevention. So it's a widely used curriculum, and one of the great things about this curriculum is that there's been some conversations on how can tribal communities use this curriculum? How can they relate to it? And so there was a concerted effort early on there's a conversation to address that. But finally, in 2012, there was a group of Native experts that came together and started having some conversation and collaborated and developed, did some cultural adaptation of this curriculum. And then it was piloted in 2012 in several different communities. And now it's been trained in many tribal communities. Perhaps this is a community training that may be coming to your community sometime soon. And as I mentioned earlier, this particular training is good for certification. It's recognized by ICRC and the National Council on for Addiction Center. So these are several areas that actually recognize your training for certification. I know here in the state of Minnesota, where I live, I was able to become a certified prevention specialist with this taking this particular course. And so, as I mentioned earlier, this is a 5-day training. First day, obviously, is a virtual online training that covers the basics of prevention and drug and alcohol, different types of drugs and alcohol that we face in our communities. And then day 2 to 5 is a face-to-face. And you can have up to 35 participants during those trainings, which is really good for any kind of community where you can invite so many folks to the table and have a robust face-to-face, engaging, interactive training, and get so many people taking this training. It's just gonna it's awesome, because when I think of prevention, I think of community prevention. You can't get enough people at the table to take this training so they can make a difference in the community. Now, with this pandemic, we had to switch gears, both Connie and I, and we spent hours figuring out how we're going to make this into our virtual training. And believe it or not, despite my own skepticism, we made it happen. In fact, we're going to be having a virtual training next week in the Saginaw, Michigan, Chippewa tribe in Michigan, and actually I think it's our 3rd time out of the chute on that one. So we're pretty excited about that. One of the takeaways for this training is the tribes will get up to 26 hours of credit towards their certification, which is really awesome. So moving on. So, there are some benefits to this training. As I mentioned before, it's a real good tool for planning. And one of the things that I always stress about planning, and this particular curriculum, the 5-step process, it's a decision-making, it's a data-driven decision-making process. The more data you have in your planning, the more that you can target your strategies and build your goals around those strategies and really make a difference in the community. So we'll kind of touch about that a little bit more. But it definitely increases the knowledge and the principles of prevention. Folks will become familiar with the Institute of IOM, the Institute of Medicine and Public Health approach to prevention, and we'll take a look at that in a little bit. But like I said, it utilizes the SPIF, the 5-step planning process: assessment, capacity, planning, implementation, and evaluation. And again, to reiterate, you get up to 26 hours of credential hours from this training. So one of the things that really helped us as we went forward from each training is garnering feedback from the participants so that we can improve or learn what are they getting out of this training. And one of the things that I know that Connie can attest to too is it's very interactive. There are 7 case studies in this particular curriculum, and grantees get into groups or breakout groups to work together on through these 7 case studies throughout the 4 days, and it's they really appreciate the opportunity to work together on these activities, and then when they walk away, they feel like they've really gotten something out of it. They've increased their knowledge and their skills in prevention. And it was definitely relevant to the work that they are doing in the community on prevention, whether it be in substance abuse, suicide. And we know there's lots of different substance drugs in our communities, whether it be alcohol, opioids, or whatever, that it's been really relevant to that work. And then I think we go back one slide there. Oh no, you're right. I'm sorry. Okay, so setting the foundation. I'm just kind of curious. We talked about going from theory to practice. Practicing all that we learn in a setting like this. Curriculum and stuff, and how it applies to practice in our everyday work. So I'm just curious how many might know the meaning of behavioral health. When I say behavioral health, what does that mean to you? Anyone want to take a shot? What that might mean? You can put it in there. You can either turn your mic on, or you can just put it in the chat. Behavioral health. What does that mean to you? All right, I'm going to take a healthy risk and share it with you. All right, so Jessica said that encompasses the mind, body, and spiritual health. I agree with that. Yes, I can agree with that. Person, environment we live. A state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and able to make a contribution to his or her community. Thank you, Mark. Yeah. To me, it means maintaining a healthy mental status. Traditional healing is focusing on the entire being. I agree. Thank you, Yari. And Aaron, social, emotional, mental, spiritual health. All right, I'm sure there's others that are going to be popping up here, but there's some really good definitions. The one that I'll share with you today is, and you're all are right on. We just said it in a different way. There's many roads to Rome. There's many roads to the defining behavioral health. It is a state of mental and emotional being. It's about choices and actions that affect our wellness. So it is about our physical, emotional, mental, spiritual selves, and the actions and choices that we make that affect that. And so that we'll talk about that a little bit more. What are some things that might, in this case, put our health and our behavioral health are in at risk? So we'll talk about that more. And then we'll be talking about continuum of care. There is, A lot of you are doing prevention work. Some of you might have been doing intervention work for folks who maybe are has experienced an addiction issue or some other behavioral health issue that that they need some kind of support and treatment or intervention. And then we'll talk about the public health approach and how that is connected to the Continuum of Care, which is developed from the Office of approach to let's see, I can't remember now. Anyway, so and then we'll talk about risk and protective factors and how that contributes to the health and well-being of our youth and our communities. And then we'll also be talking about developmental perspective. And then we'll get into the SPIF, the Strategic Prevention Framework. And by the time we're all done here today, you know, the acronym for that is SPIF. You can be all spiffed up. So with that, hey, Connie, I'm going to turn it over to you because you're going to talk a little bit more about the other approaches.
Thank you, Dave. Awesome. Yeah, one thing that we do know is that many of you are familiar with some of these terms. Many of you have had parts of the training, but there's something about having the full training that make all the pieces fall in place. And Dave kind of spelled out some of them. And one of them is the Continuum of Care, which I'm sure many of you are familiar with, especially cohort 4 and 5. So cohort 6 is going to really appreciate any mentoring you can help them with. But we're looking, and these all connect, they all connect to public health model. And we really want to look at that because we want to take into consideration, we're going to go over all the things we take into consideration when we're working with our community and trying to make a difference, you know, focusing in on improving mental health, increasing cultural activities, all kinds of different things. So as you can see, you know, when we do the larger training, we kind of break it down. And some of these, terms you're very familiar with, like promotion, like getting that word out there, letting people know that help is available. We use promotion a lot for, you know, the concerns we have about the mental health, the stigma around mental health. We want to break that down. We want people to feel as comfortable about having mental health and getting support for mental health as the same as they do for their physical health. That's our goal. So there's a big part of promotion that you're all doing. So please feel free to put in the chat box some of the promotion that you're doing as well. And then some of you are super familiar with the prevention approach that we use on the Continuum of Care, which is the universal, selected, and indicated, where we're looking at certain populations, certain parts of the population, and really zeroing in our efforts. But I bet what most of you are doing is focusing a little bit of efforts on each one of these areas, which is really good. So I don't know if you want to share in the chat box your understanding of what universal, selective, and indicated is. That would be great, just to know your knowledge. But I will also talk a little bit about it. So when we think of universal, I think most of you know that we're kind of thinking of the overall public, that we want the overall public to understand the importance of mental health, the importance of removing that stigma, and the importance of us having that as part of our medicine wheel of needs that we have and treatment and support that we have, whether it be cultural or whether it be from our clinic or whatever it might be. But everybody needs to know about that, and everyone needs to know about how to prevent some things from happening related to mental health too, what those symptoms are, whatever. And then when we think of selective, we think of people that are at risk, that are currently at risk. They're not as great of risk as some folks, but they're just starting to show signs of some issues or problems that may lead to eventually a mental health issue, or being out of balance is a lot of what we call it in our Native communities. And then looking for ways to try to get those folks back on track by some of the interventions that we do. And then also we look at indicated, and those are those at serious risk. And so I think many of you in your communities are covering all of your bases, but the ones at serious risks, we definitely want to make sure that they have a roadmap to get to the treatment that they need, or to get to the people that they need to be working with, whether that be clinical, whether it be traditional, whatever it might be. So once we've got that figured out, we can help move that continuum and get people the help they need across treatment and then some maintenance, but we're always doing promotion about all of that. So that's kind of a brief overview. And please let me know if you guys are doing some of this, if you're already, I'd love to hear. I think it would be helpful to our cohort 6 grantees if you put some examples of what you're doing for each of these in the chat box. I think that would be super helpful. All right, so we'll move on to talking about the public health key characteristics. Okay, so of course we talked a little bit about promotion and prevention, and that it really needs to be population-based for it to make sense. And that as we're looking at the overall, as we're doing some of our data collection or doing some of our overall planning in our community, we need to look at the entire population and what areas we want to focus in on. The other really important thing, and I think you, many of you are very good at this, is understanding the risk and protective factors and actually including that in your data collection. What are those risk factors out there? And when we do the large SAPST, American Indian Alaska Native SAPST training, you get some practice on, looking at a scenario, a village out there that was typical to a lot of our places in country, and you get to look at some of that data, what their risk factors are, what are their protective factors. We always look at that in balance. And so I think people are pretty familiar with those, but those are it'll be great too if you want to share a little bit more information about what you're noticing in your community as far as risk and protective factors. Risk factors, we want to reduce those. They increase the chance that someone will have a mental health issue or a mental health problem. And so we want to reduce those risk factors. For protective factors, they increase the chance that you won't have a mental health issue, that you maybe will be able to do fine with just a minor little bit of intervention, like family intervention or whatever. And so those protective factors generally in our populations include culture. And what I noticed in our Native Connection and my Native Connections communities, culture is the foundation of their Native Connections projects. And that's all woven in all throughout because it's who we are. And so that is definitely, reducing those risk factors. It's countering those risk factors. We also want to look across multiple contexts, from the different developmental, from community to individual to, to larger, like the state even, in our state here in New Mexico, we've had a lot of high risk on our reservations because of things like coal mining. And that's definitely stopping, and we're happy for that. But that makes a difference and has affected hundreds, maybe thousands of people on nearby reservations. We're doing some fracking here too, and that has affected some of our people too. So we look at those larger contexts, and then we look at the small contexts like the family. What can we do to support the family? What needs to be done? Or there need to be more services for the family. So we're looking also across the developmental perspective. And you guys are, I think we're serving 14 to 24. And if I got that wrong, I'm sorry, I didn't pass that quiz, but I think that's the population for Native Connections that we're working with. And so, but we can also look across, into other parts of the population for elders and adults. And we want to kind of figure out how can we, focus our prevention efforts on all of those, and then definitely include as many people as we can in the planning process. From what I've seen with my grantees, they do an excellent job with that. And so they're really out doing a lot of outreach. A lot of the first year is just getting people to know who you are and what you're about. And so that way they're involved in the planning process. So I hope that gives you a general idea of our public health model and our prevention and public health key characteristics. Moving on. So we talked a little bit about risk and protective factors. This is just kind of a compilation, but you have a lot of knowledge of these in your communities. Maybe some of the students are having a really hard time right now. That is a risk factor. COVID is a risk factor. The virtual learning is very difficult. It's very difficult, especially in our Native communities where we don't have access to good internet services. And so we have children that either are missing in action or failing. And so that's a risk factor we want to look at for the future as we're planning. Racism, all the things we've heard lately is definitely a large risk factor for us. So we really want to, look at the balance between, you see some pictures of folks where there's really great interaction between families. Their parents and children are having great interactions. The environment is a great protective factor, and that's something we all take into consideration. And that's my niece in that picture, and she was helping me a little bit with American Indian life skills training at one point. And so that bringing culture forward to teaching skills is definitely increasing a protective factor for them too. So we'll move over to the next slide and we'll talk a little bit about risk factors. And many of you are familiar with this. So, the definition is really those characteristics that cover a lot of different areas, are biological, psychological, family, community, or cultural level. So, and I think if you want, you could type some of those in the chat box that you're seeing. I know that I mentioned COVID, but, we even in general, the history of trauma in our communities and needing to understand, that trauma affects us to this day, gets passed down into the DNA at times. And we also have great things that get passed on too. We'll talk about the protective factors, but we need to understand that it's associated with a higher likelihood of problem outcomes when we're dealing with these different things. So moving to protective factors. So as I see someone has typed intergenerational and generational traumas. Thank you, Yari, I appreciate that. So it's the opposite for risk factors, a characteristic across these things that I mentioned, biological, psychological, family, community, that are a higher likelihood of problem outcomes. So as what you're doing right now and what I see my grantees doing, or you're learning about those risk factors, you're learning about those protective factors, you're increasing those protective factors, but you're trying to reduce those risk factors in the different interventions that you're doing. So a lot of that happens during this assessment part of it. And I think a lot of you are doing a great job with that. And Dave, did you have anything to add?
No, I think you're doing a real good job there. It's just know that some folks have mentioned that lack of culture and historical knowledge is a risk factor. And actually, I'll reference that a little bit more later when we talk about evaluation piece. Okay.
Sounds good.
Hazel said poverty and disabilities. Marty, interracial marriage, physical looks, food security issues, another risk factor. Lack of access to medical health care, something that comes to my mind.
One thing you'll learn if you do take the course is, a lot of the case studies are focused on substance misuse, of course. And so what do we need to do to reduce those local risk factors? Maybe access is easy in some of our communities, and maybe there's not a lot of education on how it affects a young mind when underage drinking happens. So those are some other examples.
And you already mentioned loss of identity.
Yes, it's a big one.
Someone had asked if this PowerPoint could be made available, and BC just provided a link to the PowerPoint. So you might want to grab that if you want to take that back with you. And it is a large file. I had to carry it back home in 2 boxes.
That's the SAPST manual when they get it.
Exactly.
You get muscles.
Yeah, we definitely need a big cloud. All right.
We're ready to move on to the strategic prevention framework.
I think you got the protective factor there yet.
There we
All
go.
right. All right. So got this beautiful flower that represents the strategic prevention framework. So from this point on, we're going to talk about the 5-step process in the planning. I had a call earlier today with another grantee who had indicated they received a lot of grant awards this year. They were actually pleasantly surprised. And as we were continuing this conversation about their Native Connections grant and some of the other grants that can support what the work they're doing, they fully agree that taking this course would be helpful in their planning, because they realize that this 5-step process would help all those particular grants in terms of planning, developing a SAP or strategic action plan, and it ties into the CSR, the community systems analysis, or the CSA, and the CRM, the community readiness model or assessment. And we're going to kind of touch on those too as we are talking about this particular model. And we'll also talk a little bit about sustainability and cultural competence, weaving culture into the planning process every step of the way. Right? Moving on. Well, obviously, the first place we want to start in any kind of planning is doing an assessment. Assessment is really important. Some of you had to have some data before you wrote the grant for the Native Connections or other grants. It's really important to have some data, right? So you could tell your story, hey, and your need. And again, I'm reminded of that phrase I mentioned earlier. This is a data-driven decision-making process. So you needed that data before you even started the SPIF process. So, obviously you will speak to what's going on, what's the problem, to what extent, what's the frequency, what's the trends, and all those things that are going on with substance abuse or suicide. And then looking at some of the risk factors that are contributing to the problem, and also looking at what are some protective factors that protect our youth, our community, to keep it well. So having all that data would be important to have. And then scanning your community. Well, hey, what kind of resources do I have that can help support my grant? This important work we need to do in prevention. And and are we ready to do this work? What do we need to know about that? And that's why I mentioned that we need to have so that data to help us make some important informed decisions in our community, because we want to target our work, and we want to get the best bang for our buck. So it's important to have some really good baseline data, right? Okay.
Yeah, and Dave, I just want to mention that data collection was done in a different way hundreds of years ago. That's why we're still here. So sometimes that word assessment or data is a little scary for some people. I know some of you guys are old hats and you're collecting wonderful data. You really get the importance of it, but that's why we're still here, because we were always collecting like orally or visually data and sharing that in our community so that we can make good decisions, so we could survive and thrive, actually. So just want to make that quick point.
Very good. Thank you, Connie. So from assessment, we want to go to the next step, which is about capacity. So in capacity, this is again collecting more data, finding out more what do we have in our community, what kind of resources do we have, who are some people that we might want to identify in our community to help us with this prevention effort, or some cultural elders, youth, organizations, you name it, faith-based organizations. We want to look far and wide and deep in our community because we do have, every community has an abundance of resources, and it's important to kind of identify what those are, even write them down. And this is where we had mentioned the CSA. Most of you probably have used that tool that we developed, but it's like you're doing an environmental scan of, well, what's going on in our community. And also, when you use the CSA, it can help you identify some gaps you might be experiencing, be important to identify or build in your community. So, but also readiness. Is your community really ready to tackle some of the prevention work that you want to target in your community around substance abuse or suicide? And it's really about meeting your community where it's at. And sometimes that's really the best place to start, is meeting them where they're at and working from there so you can go forward together. Again, it's so important because this piece really leads to more planning down the road when you start looking at partnerships, collaborating, connecting. So, there's so many steps that are involved with the assessment and capacity. It dives deeper, but we're just kind of scratching the surface here. So, with that said, let's move on to planning. Oh, well, wait a minute. We're gonna just talk a little bit about this this particular case study here. As I mentioned earlier, there are 7 case studies to this curriculum, and in the 5 days or the 4 days that we spent together, we go through these case studies, and it involves a lot of reading, involves groups working together and coming to a decision based on the data that they have to make some informed decisions moving forward. So we would just kind of describe a little bit about this activity instead of actually doing it, and because of time restraints. We were thinking, well, we're going to really get into this, but I think we were just Connie and I were pretty ambitious. So, but just to tell you, there's an activity that you read about this the community, looking at all the data, and you start trying to sift out some resources that you have read through in this about this community, and also kind of looking at some maybe some gaps and resources that you think might be important to have in making some decisions in terms of building capacity, but also looking at some readiness in your community, because we really want to be mindful of where our community is at, because there might be some barriers, might be some challenges, and those are things we have to take into consideration. How many times have you caught wind in your community of a particular program that's been there for 5 years, but you just heard about it, and they're working on maybe, for lack of a better idea, teen pregnancy, and you're thinking, what? We have that problem in our community? No way! I can't believe that's going on. Or you can get that kind of response about suicide or a particular substance abuse around opioids or alcohol or marijuana. So, working with the community where they're at is really, really critical. So, and this is about a 20-minute activity. So we decided we're just going to talk a little bit about it instead of diving deep into it. I guess you have to take the training to learn what that is, but it's really awesome. Okay, so but the next step that I was so eager to talk about before the break is planning. And this is again where you're going to be taking a look at the risk and protective factors you identified that contributed to the issue in your community, whether it be substance abuse, suicide, what have you. And you want to ask more questions. Um, so are we selecting the right risk and protective factors? Because there are so many, and you kind of have to prioritize them, so to speak. Yeah, in fact, that's what you have to do because you want to target those risks and protective factors. How important are they? What roles would they play in addressing the behavioral problem? And maybe there's more than one behavioral problem that particular risk factors um, is contributing to. So maybe that makes it really important to select that particular risk factor, whether it be um, uh, intergenerational trauma or um, you know, uh, cultural identity, those kind of things. And also, what are the chances that it's going to have an effect on changing the behavior, that your outcome, as you're thinking about the outcome of uh, the risk factor of changing that, that's going to really make a difference. And as you begin to think about implementing. So, two things: the importance of that risk protective factor, and what are the chances that it has a high probability of it changing. Um, maybe maybe it'll change it real fast, or maybe it'll take time or more time and effort, and that can also um, contribute to a higher cost potentially. So after planning, after you really take a look at some of the risks and protective factors, it's important to begin to look at some interventions. Now, though, I know some of you in your communities, maybe you've have some interventions that you selected, um, whether it be you know um, like American Indian Life Skills or Project Venture, or maybe it's if it's suicide, you're looking at QPR assist or youth mental health first aid training as some form of an intervention. And and you selected those because you found that they're effective. They've been proven to be effective because many communities have used them, and they've seen some change in their community. So, but also, here's where we want to talk about being culturally relevant and appropriate, and is to consider some cultural approaches within our community that are best practices. We used to frame things up and as evidence-based, but we also have cultural best practices that have been able to be great interventions. And so those are other things that we have conversations about and doing the face-to-face or virtual trainings. The other one is conceptual fit. Will the interventions impact the selected risk or protective factors? And the practical fit: is the intervention feasible for the community? Is it the right intervention that would be get the best bang for your buck? Again, it's a data-driven decision-making process. There's so many steps to planning, to developing a strategic action plan that is going to make a difference in your community. So having ongoing conversations with your advisory board or with your youth or with champions of the community about interventions. Let's have some input. Let's make some informed decisions about interventions. That's really critical. All right, next. Well, now we've got to assessment capacity and planning, we want to look at implementing. This is where the rubber meets the road, right? You're going to get out there and get it done, so to speak. But before you even do that, there's some more planning to be done. You're scratching your head. Really, we got this more planning? I mean, this is really intense. It can be intense, but it can be fun too, as you're sitting around the table and having these conversations. You know, earlier I mentioned partnerships and collaborations. This is where you really want to look at the resources in your community, some champions, some organizations that are doing some similar work that you know you can count on in helping you to implement your prevention activities and strategies in your community. But also, you know, they're looking at building capacity, getting some folks on your team trained in this particular curriculum is another one, a good example, or you know, QPR or assist, those other kinds of things that helps to build your capacity and to be more effective in as you're addressing the needs in your community. And the other thing that, you know, when you do the trainings or the intervention in the community, is it really based on evidence-based? That's another important factor. Are you implementing it the way you said you were going to implement it, and is it working? And that's where, you know, again, you get into the monitor your strategies, and you want to evaluate and adjust. I remember a few years back, a community was talking about how they were evaluating their after-school program with youth, and you know, they were hoping to target 20 students, but after a month, they found out they were only getting 5 students in attendance. So they were scratching their head and thinking, what do we need to do? Maybe we need to get the information out there a little further in the community, maybe some kind of marketing strategy. But then they found out after more digging that during that same time, on that Wednesday, they found out that there was another activity going on that a lot of the kids were going to. So all they did is change the date and time, and voila, they got a lot more youth participating in the program. So wouldn't it be just crazy to just kind of continue with the status quo and not change anything because we're not evaluating or paying close attention to how can we be better, how can we be more effective? And that's what evaluation is all about. So if you have an evaluator in your team, it's important to always include them in your in this process too. The call I had earlier today with another grantee, their evaluator was on the call, and they plan to be in all the calls going, you know, going forward, and because they're going to have all the information that they need to support the grant, right? So there you have it. All right, moving on to evaluation. Two things, takeaways today is that there's 2 terms that we really talk about in this training, and it's process evaluation. And it's a process evaluation is what it's referring to is evaluating while you're implementing a specific curriculum intervention while it's in progress. Just like they shared the story, they changed the day and time of the activity, and they increased the number of students that were attending. If you wait till the end, it's too late. Oh, I wish I would have changed at the beginning, because we probably could have had a lot more youth attending, and we could have made a difference with a lot more youth, and that would impact our community. So it's like thinking smarter and not harder. That's what I love about process evaluation. When are you How often are you evaluating your activities? So important. And then, of course, we want outcome evaluation. What's the takeaway at the end of a particular curriculum or intervention? Here's where you want to look at knowledge. Were we able to increase the use of knowledge about their culture, about their language? Because I think somebody mentioned earlier that a lack of knowledge of their culture and everything could be a risk factor. So you can measure that, can't you? You can do a pre and post test. You can measure an increase in knowledge. Also, excuse me, you can also measure a change in attitude. And when you see a change in attitude, you're probably going to see a change in behavior. So in what ways do you measure a change in knowledge and attitudes and behavior? Because those are really some good aspects to keep track of and gather that data. All right. So with that, I'm going to let Connie talk about cultural competency.
Yeah, and I thank you, Dave, for all those great comments. I know you touched on it too, and I think we're kind of preaching to the choir about cultural competency. From what I've seen, our communities do make a large effort in making sure there's inclusion and making sure that culture is, part of it. But also did want to let you know that this particular slide and the information that it has about all of these different ways to look at the importance of building in culture into our prevention planning and implementation and evaluation. This came from Carolyn Cruz, a publication called Many Pathways to Follow. And she used to be a CAPT associate that, was mentioned, Dave mentioned earlier on. So it's really good when communities really focus on what those are that they or think that are really important. Like I see a lot of our grants out there using the multi-generational approach, so that the interventions involve elders helping youth or youth helping elders, whatever it might be. So and I see a lot of our communities making sure that tribal language is a part of what they're doing, because language is preventative. Knowing your tribal language is very preventative, and there's research on that, as I understand it too. So this is kind of a beginning place to think, and you probably have your own way of doing that. And another thing to think about too is there's subcultures within our culture. And so recently, and my colleagues on here with me, Jennifer, she did a great job. We did a presentation on mental health and wellness, and we looked at our LGBTQ plus community, and that being a subculture, and that being something, with the high risks we have. What is our ability to appreciate that diversity and make sure that we understand what is needed? Make sure we know that we're not missing any parts of that, include that in our research and our evaluation and our assessment, all that. So questions you ask yourself: do you appreciate diversity? Are you able to function effectively across those cultures in your community, whether it be youth, elders, LGBT community, anyone that's in your community? And then you're always considering that in every stage of your planning and implementation. So definitely things to think about. Not that you're not doing a wonderful job. I've seen many SAPs over the years, and some strategic action plans that you've done. And I'm always seeing that, but keep that in mind. And then we always have our allies, our non-Native allies, and they really appreciate trainings and help, so they can be culturally competent, so they understand. And so making sure that's built into whatever you're doing too. So I'll go ahead and talk a little bit about the keys to sustainability.
Hey, Connie.
Yeah.
There's a question by Lindsay here about working in an urban Indian environment. Do you want to speak to that?
Okay. Yeah, let me read it real quick. Well, that's a good question. She's asking, that in the urban Indian environment, it's a complex cultural competence dynamic due to the diversity. I forgot I was going to comment on this because I worked with several urban communities. What I've seen is what people are doing is really respecting each and every culture that's a part of that urban center, and pulling people together based on some common beliefs and values, which many of us share, and maybe doing training on that. What do we share in common? Is it important for us to take care of our families? Is it important for us to pray or to do our ceremonies? When we're disconnected, can we pull our ceremonies together? In some of our larger urban centers, different types of ceremonies that might not be part of that community are used to keep us together. Because I was in my grad school. When I was in grad school, I was in the Los Angeles Indian community, and I don't think I would have made it. Really, I wouldn't have made it without the support that I got. So finding that common ground, and doing training around that and pulling people together. The urban centers that I worked in, the types of activities they were doing brought people together to talk about those things. And that in itself helped. And then some of that was built into the planning. And also, I think we have some colleagues here that do the virtual GONAs. And virtual GONAs in urban centers bring everybody together, and they already have those common values that we share, because GONA does that, Gathering of Native Americans. So that's an idea. I don't know if that's helpful, Linda, but please, reach out to us after if you need a little bit more discussion on that. We're happy to do that. And also, if anyone else has other comments to make or can help with Linda's inquiry, that'd be great too.
Hey, Connie, just want to make another comment about that. I know that over the years, tribal communities in urban settings, they have a really mixed population of youth in their community. And so some communities, that are driven by the advisory board say, well, we only need to service our own kind, own community. But then there are other ones that have a more of an open mind where they are reaching out to youth, no matter what tribal affiliation they come from. And to me, that embodies, that cultural competency of, working with all tribal youth, and that maybe that's part of the complex issue that might be occurring in your community. But I know it's a challenge sometimes. But yeah, so I just want to make that comment.
That's an excellent point. And I think, everyone understands how important youth are, and they are our future. And so I'm glad that you brought that up, Dave. And then also Jennifer says it's always good to acknowledge that urban migration began in part due to American policies designed to remove American Indian Alaska Native from reservations. And now it's due to economic needs and housing. But I'm so glad that, when that happened and then generations of people grew up, there's still that connection to being Native and learning your culture. During one of our trainings, when I was discussing, we actually play a video from one of the urban centers about how they brought that culture back to their children by, finding other people in the community that understand what that was or can educate them. And so that's really good too. And then Linda also says, I'm seeing a lot of generational trauma, which I hope they're open to training on identifying and then healing. Yeah, we do. I think the virtual GONA I attended, I saw so much enthusiasm and healing for people because they were hearing something they hadn't heard in a while. They were hearing the same language, and so and it's funny, virtual audiences are sometimes different. Sometimes people that don't come to on-site activities come to virtual. So it's expanded their knowledge, I think, too. So thank you very much, everybody, for your great input. So we'll move on to keys to sustainability. And Dave made a huge point that you don't start sustainability in your 4th or 5th year. You start it right at the very beginning. And, the data that you're collecting about your community is letting you know, how do you involve them? What makes them want to be involved and continue to support your efforts ongoing? Examples, some communities I've had worked with have a tribal leadership that's real careful to pass on what they thought was important to the next, usually it's 2 years, to the next tribal leaders, and they're growing their own tribal leaders. And a lot of that information that they're sharing is on prevention and on, sustainability and resilience. And so that's really important. But these are our 3 keys is, to always be building that community support from the beginning. Is that easy? No. We don't mean to, but sometimes we're in factions. We don't have enough time. We don't, even some of our federal grants discourage us, and we have to educate, a little bit, our federal colleagues. I think we can make this work. I think we can have these 2 grants and still have each grant do what they need to, but there be that sustainability of this need in the community. And then building that organizational capacity, which a lot of times takes a lot of time. It takes training, it takes connecting. You have changes in leadership in that organization. And so you have to go back and do what you already did throughout. And granted, I understand there's only sometimes 3 of you, maybe less, doing the Native Connections work. But that's where it comes in to build your community, because you're going to want your advisory board to, be out there with you. And when you lose an advisory board member, you're going to want to do a lot of outreach afterwards. And then that effectiveness that Dave talked about, you can't keep doing the same thing. And if it's not getting the results you want, you don't want to keep doing that. You want to find those interventions that you're choosing based on your data, on your observations, on your thoughts, what you're collecting in the community that are effective. And so I see people doing that. I see in my grantees are being careful, and looking at what they need to do. They do their community readiness assessment every year. They look at what didn't change, and then they zero in on that, and they change the direction of their intervention. So these are all really important keys to sustainability. There's a lot of information out there, but let us know if there's any additional information that you might need on how you do that. But the main thing is to keep doing it. Right, Dave?
Keep on keeping on.
All right.
Thank you, Connie. That's very, very well said. I don't know how many of you have ever used logic models. I love logic models because they help me connect the dots. Yeah, I need that, that visual or something to help me connect the dots. It's like looking at a blueprint. I love looking at blueprints for even building things. I'm a carpenter, so the same thing with as a prevention practitioner, I need a blueprint to help me keep an eye on the pie, my goal. What am I working on? In terms of behavioral problems, what are some risk and protective factors that are contributing to that behavior problem? And what are some interventions that are going to address those, mitigate that risk and protective factors? And what are some short-term outcomes that I need to be mindful of? And then in the end, so what are my long-term goals? Where are we going to end up after it's all said and done? So next slide. So here is an example of a logic model that addresses underage drinking. Underage drinking is a behavioral problem. It's actually a real problem in a lot of our tribal communities. If you're under the age of 21, if your law says you can't have an alcohol, it's underage drinking. And why is that? What's contributing to that? For many communities, believe it or not, it's an easy retail access. That's a risk factor. Hey, I can go to the liquor store and buy an alcohol. They don't ask for my ID. And that's a real problem. Well, what would be some interventions that would address that, those merchants from selling to those poor minors? Well, how about compliance checks? That's a evidence-based practice because, the law enforcement goes do these undercover compliance checks. They'll find those who are selling to minors, and by golly, the next day you're going to see their name in the paper. How many have seen that? I've seen that multiple times. I grew up in Rapid City, South Dakota, and you would hear almost every week 2 or 3 merchants selling to minors, and they get their names printed in the newspaper. That's got to be a deterrent, right? Hey, I don't want my business being mentioned in the paper ever again. So we really got to be careful of selling to those minors. And then, merchant education. Yeah, you can have some education tell these merchants, hey, a minor's brain is still developing till the age of 26. Do you really want to contribute to the health and well-being of their brain that's still growing? You never know what kind of effect the alcohol might have on their brain. That's one piece of an education. But just taking responsibility, having ethics and having values, living to the health and well-being to the community and stuff like that. So those are the interventions. The short-term outcome I really want to point out is really about reducing the number of sales to minors. If I have a risk factor is retail access, I really want to target, I want to lower that number. I want to make sure that these merchants are not selling to minors. And that's a number you can collect. That's your short term. And then your overall outcome is about reducing underage current use. The less youth are having access to alcohol, you're not going to have an underage drinking problem, are you? But so I know the risk factors are a little different, probably than what you expected, but you can see that it really truly is a risk factor. All right, let's go to the next slide. All right, Connie, I'm back to you.
Okay, well, we wanted to provide an example, and we know that the process, the logic model activity might look a little linear. It isn't really in when we really apply it and use it. But I've seen a lot of you, Native Connections communities, when you write your strategic action plan, you do it in a circular manner. You have a visual of what it all entails. This is an example of looking at those. This is a Title, I think it was a Title V program. Title VI program, sorry. And it was an example of where they took into consideration that public health model of the context and intergeneration, but they also looked at those risks and protective factors and their goals around the medicine wheel, where spiritual, mental, emotional, physical, increasing those spiritual activities that were important. And when it comes to emotional, it may be reducing some things that, that are kind of countering what we want to see for those folks. And so there's another way. In other words, there's ways you can present this in your strategic action plan for those of you who are from cohort 6, and then those of you that are cohort 4 and 5, you already done a lot of this where you look at it in a different way. The training we're going to do is, the 4-day training we're going to do is just kind of take a deeper dive in what a lot of you already know. But maybe help a little bit more with that data and making sure that it's connecting to those risks and protective factors. Because, you get in a hurry, you want to hurry and get this done. It really makes sense, but sometimes we miss it. And so we're going to help with that a little bit. And who doesn't? I mean, you get back on track as it's one of those constantly growing documents. So, all right, we're going to switch over, I think, to a personal example of a logic model. Dave's going to do this with me.
Yeah, Connie, are you ready for an interview about self-care?
I'm ready. I really been thinking about it lately.
Yeah, you mentioned on a call the other day there was kind of a problem, a behavioral health problem. Is that right?
Yeah, it definitely could turn into something for sure.
Okay, so they have the self-care issue, right?
Right.
Oh, okay. Well, I want to support you and help you figure this out. So what would be some risk factors that are or even some protective factors around this particular issue you're having?
Well, I think Dave, that I'm in recovery, and I had some exposure to trauma as a child. And so I think that's one of the risk factors that I have to deal with all the time and work on. And so that's just one of a few risk factors. And it did cause me to have that problem with drinking. That was 20 5 years ago, but also I'm moving into not taking care of myself, which is kind of a risk factor for drinking again. So that's why I wanted you to help me with this.
Okay. Well, thanks. And have you been thinking of ways to address it, some kind of intervention to help you?
Yeah, I really realized that over the years, I've been more and more grounded in my culture. And so that is my protective factor. And I want to make sure that I'm, increasing that all the time, building that into my daily life. So now I have some daily practices. My particular intervention is always doing my morning blessing, doing my prayers in the morning, letting go of everything the night before. I usually smudge in the morning. I always try to get up and see the sunrise, something I learned from my Navajo relatives. And so that's a big thing, a big part of my life that makes a difference.
Awesome. And in terms of framing up in short-term outcomes and lowering the risk factor, what's your goal there?
I really try to avoid, when I am exposed to trauma, I really work on my self-care activities, really like debriefing with people and doing those practices that help me. Like I read meditation sometimes, I do some mindfulness sometimes, and that's been really helpful too. But long-term is just always go back to those self-care activities and always focus on my resilience. I think about I shouldn't even be here, and many of us think that way too. And that's been a helpful thing for my long-term goal is just continue those self-care practices.
Yeah, and all the time you shared, you were weaving in some of the cultural aspects of your life and how you're sustaining this change behavior. That's great. Thank you, Connie.
Thank you,
That's
Dave.
awesome. Yeah. And so I'm going to just turn it back over to you to do a quick review. Then we're just about there.
We are almost there. We just have a quick poll at the end. I won't read all of these. So many of you were already familiar with some of these. If there was something that you weren't as familiar with, let us know. I think we're almost out of time, so I'm going to let you take a peek at these real quick. These are all the things we covered. Introduction to strategic prevention framework and the logic model were the most important thing that maybe you didn't have a lot of information on. So let's move to our, real quick, I know we're running out of time here, to our poll. Are you interested in registering for American and Alaska Native SAPST virtual training? This is the 4-day training, so it's quite the commitment. We just want to get an idea of what our work will be cut out for us in the future. So if you're interested, let us know, and we appreciate your honesty. So we've got 100% so far, and maybe we've got 89% and maybe 15%, 86%. All right. So a good number of you are interested. I appreciate you guys so let me give you the information. If you're interested in a training, you can go on to the SAMHSA Tribal TTA Center website, push on the contact us and request a training for your community. If you don't have enough folks, we'll try to look at something regional. We can't guarantee right now that it'll get approved because it's first come, first serve. But if you're interested, get your request in there as soon as you can. Anything to add, Dave?
Nope. I think you did a good job of that. So we think it's a great curriculum, and it sounds like you bought into it. That's great. And
All right.
BC, you just put the link into the to chat. So I would go ahead and click on that so that you can have that link before we close this webinar here.
We have a quick question from Jessica. Individuals can ask for the training. What we could do is when we are going to have a training, I'm going to write your name down, Jessica. We can let you know when one is close to you. We'll look at your email and see where you're from, or you can let me know where you're from, and we'll let you know a close one. We can include you in those, but if you want to make that request, probably the request would be for the whole community. So check in with your colleagues in your community to see if they'd be interested in one too. Thank you for the question.
Yeah, and let your GTA know too, whoever your GTA is.
Yep, I forgot. All right, thank you.
And so here we are. We're at the closing. I want to see if my good brother Hunter Gina is available to do a quick closing for us. I shouldn't say quick because you can't say quick to Hunter. Hunter, would you be willing to do the closing for us today?
Oh, hey, Cola. I was trying to be all quiet and be good and not give you a hard time. And jeez.
I know. Don't sing that
We
instigator
appreciate
song.
it.
Oh, my goodness. Oh. All right. Hold on just a second here. I appreciate you asking, though. It's I know you guys are doing this training here locally next week, and so appreciate the good work that you're doing. I think I got a few of my grantees that are also going to request this training, so it's all good.
Miigwech, Hunter. Miigwech.
Aho, wopila. And be safe and be well, everyone. Thanks for joining, and we'll
Thanks
see
for
you
staying.
at the next webinar